So it's my great privilege to welcome the new Minister for Health, Greg Hunt. I say new Minister even though on my count it's 65 days in the job. But it seems like it's new because it's such a big change for us in terms of the way you're engaging and the progress you're already making. When the Minister called me on day one, I thought he was ringing me in my capacity as Chief Executive of the Business Council, in his former role as Minister for Industry, Innovation and Science or the Environment, and he wasn't. He was ringing me about mental health. And he wanted to listen, he wanted to understand, he wanted to learn, he wanted to help. And for me, that was just an incredible sign of change right from the start. And that has continued with the Minister convening a meeting with the Prime Minister and the mental health sector, a new start which has seen the Minister listen to our concerns around PHN stability to service delivery, and a start which will see a new committee established to help PHNs deliver mental health reform. It's clear we're being heard, and we're very grateful that you've given up the time today, Greg, to be with us in what is, I know, a very busy sitting week. We've got a Minister who's personally passionate about this issue, and I can testify from my long working relationship with him, is a collaborator, a listener, and someone committed to action. So join with me in welcoming Greg Hunt.
The single issue that I regard as the biggest opportunity and the signature which I would like to contribute to during my time in this role is mental health and preventive health, the relationship between those two elements. So I want to start by acknowledging everybody here with Mental Health Australia as part of the policy forum. Your work is a commitment to making people's lives better and to helping those who have what is a great national challenge, a pathway through to prevention, to treatment and to recovery depending on their circumstances. And I particularly want to acknowledge both Jennifer for her work in terms of national leadership and Frank for his phenomenal drive. In a previous life I had responsibility for the Bureau of Meteorology and I was able to name cyclones. And so you actually name cyclones on an alphabetical basis. I'm still very good friends with Josh Frydenberg, who is the godfather of my little daughter and I am of his. And so I see a cyclone Frank looming on the horizon at some stage very soon. In fact, that's where I really want to begin. It was only 10 days ago that Frank and other leaders in the sector joined with the Prime Minister and myself for a round table for an hour and a half. And everybody's time is tight, but Prime Ministerial time is particularly tight. There is an endless set of demands. But the Prime Minister didn't just willingly give up the time. He proposed to me, I would like to say that I was the author of the idea, but I wasn't. He proposed to me that he make that time available to really sit down and to recalibrate where we were on mental health and on the things going forwards. And that fits with my experience in relation to where he's at and other members of the government are at, and the opposition, to be absolutely fair as well. But also to say that you then translate this to the individual experience. So a few weeks ago I travelled to Grafton, and Grafton, as many of you would know, has had a terrible series of youth suicides, and it has such a profound impact on a town. And along with Kevin Hogan, the local member, the member for Page, we met with 4 different families over the course of that day, and all 4 had had children who had either suicided or attempted suicide. 3 had lost their lives, and 1 had catastrophic lifelong journeys. And so to meet with those parents was a very powerful reminder of the reality of a situation where 3,000 people lose their lives over the course of a year. And whilst we were able to take steps for Grafton in terms of the suicide prevention trial sites and also the a new headspace, it's an issue which travels right around the country. So none of us are exempt. I know my own family, and my story's been a little bit more told than I'd ever intended. My own family has battled it. I'm just a dumb Aussie male, and you don't need to vote yes at this point in time. And so, like most Australian males, I had sort of never talked about the fact that in our family, my mother had battled bipolar and manic depression, and in fact, the last time I saw her, she was in institutional care. And I'd sort of buried that down for 20 years until a very good journalist asked me a question about mental health a few years ago, and I just blurted it out. And as a consequence of that, it was followed up by the Satellite Foundation. And the Satellite Foundation, as many of you would know, takes care of young people who have parents with mental health issues. And I became a patron of that and became increasingly engaged in the issue and in the sector. But of course, the scope and the extent of mental health problems covers, as I say, every family in one way, shape or form, every room, every community. And the fact that 4 million Australians face some form of chronic or episodic mental health condition each year just gives you the sense of scale and scope and challenge which we have to face. And that's why I have specifically included mental health as one of the 4 pillars of our long-term National Health Plan. The first is strengthening Medicare and the pharmaceutical benefit scheme. The second is strengthening our hospitals and private health insurance to bolster each other. The third is the issue of long-term medical research, and the fourth is mental health and preventive health together, and to really elevate and build on the incredible work which has been done. As part of that, there's been an enormous step forward over the last 15 years in the destigmatisation process. Many of you have been involved in that. You might credit the moment of creation of Beyond Blue and the role of Jeff Kennett and so many others, and I really welcome the appointment of Julia Gillard. She will lift it to an extra level in terms of profile, as being the moment when the destigmatisation really began in Australia. But that journey has to continue when you consider that there are that many people who face the challenge to say, look, this is just perfectly normal. It's like tearing a hamstring, it's like a cardiac issue, it's like any other medical condition, except more prevalent. And that's the point, more prevalent. So one, I have a role in the destigmatisation, but two, and I think equally as importantly, bringing additional frontline services. That for me is the test of success at a personal level. If at the end of my time in this role, we've been able to provide a pathway towards more additional frontline services and a more integrated care system. So then let me deal beyond the place of mental health as one of the 4 pillars in what we're doing, with the second and third points being the actions we're taking, but then perhaps most importantly, the framing of the future actions and priorities with yourselves and the way in which you can assist with that. So the actions we're taking, look, we contribute about $4.2 billion a year to mental health. That's through a combination of the medical benefit schedule, the pharmaceuticals, the support for the hospitals, but then of course the direct support. Now, much of that is now travelling through the primary health networks, and I think the most important thing, Frank, from our discussion with yourself and the other mental health leaders only 10 days ago, is the actions that I'll outline shortly to strengthen and oversee the primary health network delivery of mental health services. But in particular at the moment, we are rolling out a wave of mental health support aimed at a series of things. Firstly, there's an overall package, and yes, it's about $192 million, but it's not the money. It's the fact that it's focused on 3 big things. One is the primary health mental lead sites. So there are 10 of those around the country, and they've been linked to primary health networks, but that's the start, not the finish of the process. The second is that there are the 12 youth suicide prevention trial sites around the country, and that I think is going to be an extremely important initiative. And each of those will take different approaches, which I do support and encourage, and they'll be tailored to the needs of different areas. It could be that in some areas it's about economics, in other areas it's about culture, in other areas it's an overlap. And then you can have the problem of contagion, as we saw in Grafton. It's a very real clinical problem where the depression and the anxiety and the grief which comes from one loss can then spread and lead to others. And then the third of the actions we're taking is to support additional rollout of frontline services through Headspace, and there are 10 new Headspace support services for rural and regional communities which we're in the process of identifying and announcing. But then I really want to go forwards to the task and the challenge of the additional circumstances. And I begin with acknowledging that, as I've said publicly before, there are gaps, significant gaps in psychosocial services, and one thing I am very aware of, and many of you have made this point to me, is with the transition to the NDIS, there is a real risk of an emerging gap. And so Christian Porter and I have been meeting. We talked about this with the Prime Minister, and this is something that I will be raising tomorrow with the Council of Australian Governments Health Ministers. We're all meeting in Melbourne, and it's virtually priority one for me in terms of my discussions with the states. So what are the things that we'll be doing going forwards? One is to address the psychosocial services, and I want to work with the states on creating an agreement where if we provide additional funds, it will be matched by the states. So it'll be a matching process for additional psychosocial services. So as one doesn't provide, the other one doesn't take away, that we're actually providing an incentive that if they provide $1, we provide $1, and we do that up to quite a significant level. So a lot of my last few weeks has actually been focused on this question of psychosocial services. It's being dealt with in different ways in different states. But I can see that there is the risk of an unintended gap emerging, and frankly, it's my responsibility to deal with that. It may have been created in the past, but now is the moment, and so this is item number one for me to raise with the other ministers. The second thing is the... thank you. I have to confess, I'm simply channeling you guys. So that is what I'm doing. Item two is the need for a national suicide prevention plan. And yes, there is a version of that, but I think we need to update, to redo, and then to lay it out properly again. And as a fundamental element there, and this is something where many of you will have met my mental health advisor, Tina McGuffey. Tina, where's Tina? So Tina's up the back. Tina is basically full-time on mental health within the office. And something that she drew to my attention very early on is we know the single group of people in Australia who are most likely to take their lives. And that group is those that have been released or discharged from hospital having self-identified, either being there after an attempt or after self-harm or after self-admission from self-identification of strong suicidal thoughts. That is the group who, after discharge, are overwhelmingly the most likely cohort in the country to then go on and take their lives. So we actually know the very people, but our aftercare services are inadequate. And this is the area where we can make, in my view, we have to work across the spectrum, but make the most targeted and effective concerted set of efforts to achieve an outcome, and that outcome is saving those lives. And we can actually do this. And so as part of the National Suicide Prevention Plan, that focus on aftercare is going to be a real initiative as we go forwards. The other big area is in terms of the primary health networks. And with regards to the primary health networks, I genuinely support the delivery of the local services at the level of the 31 networks. But my view is that the guidelines were insufficiently they were too broad and too loose. And so there are two sets of things that we need to do to make them more effective in the commissioning and then the delivery of the services. One is, and I'm delighted to announce today that on the suggestion of Frank and the other members who joined with the Prime Minister last week, and within 10 days we've made this decision and structured it, we will be establishing a mental health community PHN task force and panel to overview the way in which they are structuring the to redo the guidelines and then to overview the commissioning process for each of the 31 PHNs. Frank will co-lead it with Peggy Brown from the Mental Health Commission. There will be representatives from PHNs, but in particular from throughout the mental health sector, and this will take the form of redoing the guidelines, but then overviewing each of the 31 PHNs, doing intensive work on their individual commissioning to make sure wherever possible we are building on existing services rather than simply creating or destroying and recreating. And that, I think, is a very important initiative. It came straight from the mental health professionals and the sector, and we've tried to turn that around very quickly. I think that there is a gap. We can address it, and to appoint the panel to oversee it, and they will report directly to me. So we've taken out the many filters and bureaucratic layers, and it's a direct report to me, and and they'll have the ability to meet directly with and overview, review, and make suggestions to each of the 31 PHNs. I met with the PHNs last Thursday night. I outlined the fact that this is exactly what we'd be doing. And I've got to say there was a bit of a sigh of relief from many of them who felt that they were sort of in the dark. They'd been let loose without sufficient guidance. And of course our mental health nurses will be there as on the committee and as part of it. And mental health nursing, I think you'll find that we'll be doing a little bit more to strengthen that as we go forward. So that's the broad direction. The importance you can see, but it's the plan going forward through the 5th National Mental Health Plan. That's how I want to provide the incentives to the states on psychosocial. That's how we want to deliver the National Suicide Prevention Plan, and to invite you to participate in that process, to be directly in contact with myself and Tina, and to thank you for your work. It is just simply a shared and joint passion.